You're listening to the Mommy Labor Nurse podcast, where you'll gain the tools, knowledge, and confidence you need to erase the unknowns, feel in control, and have an even better birth, no matter how you deliver. My name is Liesel, mom of two, practicing labor and delivery nurse, and your host. From over 8 years and counting of working at the bedside, I know that knowledge is the key to an even better birth. So tune in each week to learn about all things pregnancy, birth, and postpartum from me, a labor and delivery nurse that's seen it all. And now let's get into this week's episode. Hello, and welcome back to week 5 of the 12 weeks of labor. This week, I have a cool episode. I have a guy, the only guy I've ever had on the podcast. AJ came onto the podcast because guess what he is? A male L&D nurse. And I did this interview years ago with him, and he was so much fun to have on. So I just wanted to re-air it because I got to listen to it again. And he's just hilarious, you guys. You're going to love him. And we just had such a fun conversation. I asked him some good, spicy questions too, and he had some fun responses. So I think you guys are going to really love him, and I'm happy to, have this one out as week 5, right in the middle. Well, I guess next week will be right in the middle, right? But right in the midst of the 12 weeks of labor. So I hope you enjoy. Hi, AJ. Welcome to the Mommy Labor Nurse podcast. Thanks so much for being here today with me.
Thank you so much for having me. So excited to be here.
Yeah, we have a pretty cool episode today for you guys. I said in the intro that AJ is not a mommy labor nurse. I almost said he's a mommy labor nurse employee. No, you're not. But you are a labor and delivery nurse, and you're a guy. So I thought it would be fun to have you on this podcast and just talk some labor and delivery kind of stuff because not very many of you, I think, exist in the world, which, it is what it is, but it's pretty cool to talk to someone like you. So can you just start by telling our listeners a little bit about yourself and where you're from, your family, all that good stuff?
So my name is AJ, and I live here in Chicago with my husband and our 2 kids. They are 2 and 3 years old. And Aww. I have been a labor and delivery nurse for 8 years now, so just shy of a decade.
Wow.
I graduated from Rush University with my master's of nursing and immediately went into OB nursing, L&D, postpartum, antepartum, that whole.
Yeah.
And I've been doing it ever since. And it's been such a joy, such a great career, so rewarding. I've been doing that, and it's been truly wonderful. It really has.
Yeah, no, I love it. Well, we're going to talk about all of that good stuff today. So I guess firstly, what is it like for your patients? Maybe being a male D nurse, do you ever get any pushback, or what is it like? And what is it like working with other employees? Do you work with any other male L&D nurses, or have you ever?
So I have never worked with other male L&D nurses. I have had one male midwife that came and covered some of our residents on a specific day, but hardly ever saw him. But in my 8 years, not one other male nurse. There was one male NICU nurse once that I worked with, but I am the only one I know of, especially in Chicago. I think, at least that I know of. I've bounced around, a few places as far as as I also used to teach OB, and I haven't met one yet, but it has been, surprisingly not what most people would think. Most people would think you would get a lot of pushback, and I don't. In the beginning, starting as a labor and delivery nurse, I was really worried about that. That
I was going to say
that there would be patients that would just always say no, or I would just never get a patient because everyone would say no.
Yeah.
But it only happens with patients who have a religious reason for not having a male nurse.
I was going to say that's the only time when we have issues, here at my hospital is the anesthesiologist is a male and they, would want a female, or even, the doctors, the residents that I work with, a lot of them are male. So exactly. I understand that from that standpoint.
So it's usually when it's never, I don't want a male nurse. It's usually just no males entirely at all,
right.
Which we always try to accommodate for if we can. Of course, if there's an emergency, it's one of those things where like, I'm sorry, but this is an emergency and we only have so many hands here,
Yeah.
and I happen to be one of the hands. So no, I don't want to say never because it has happened before.
Yeah, of course.
There has been patients in the past who have said, I don't want a male nurse, and not for a religious reason, but just because it was their preference. And we always respect it, but I can count less than on one hand. The number of times that's happened. And I've been doing this for 8 years. And I think like, when you initially go into a room and they see you and you're a male nurse, first they think that you're either the resident or the OB. Initially, that's what they think, which, is not fair for someone to think that right away, that you're a physician just because you're a male. I hate that. But I always correct them and say, actually, no, I'm your nurse and I'm going to be with you today. And
see this little RN right here on the badge.
Right. And prior to the pandemic, you would get to see that expression a little bit more. Now it's just the eyes and you have to read the eyes. But for the most part, like, at first you would get people like, their eyes would be like, okay. Or you would like, the husband would kind of be like, oh, But after you, do your introduction and you start talking to them and they start realizing like, okay, he's not, he's not a threatening person. Like,
he's actually like a really nice guy. And I mean, you seem I've only just met you, but you seem like you give good bedside manner and you give good patient care. So I'm sure I hear that a lot. You probably like initially they're like, but then once you actually start assessing them and start talking to them, it's like no big deal.
Yes. And honestly, not to toot my own horn, but I have never had a patient complain.
Go ahead.
I've never had a patient have a personal issue with me ever. Saying, like, I don't like him. He's not a good nurse. Like he's mean or whatnot. Like all of my patients usually absolutely love me. I bond well with them. And I think it's because I try to show them like, as a male nurse, I want to be a good example and say like, look, I'm not here to stare at your privates, and to be inappropriate. My job is to take care of you. And I can do that as a guy, So I really make it a point to kind of be a good example for future male nurses or for any other encounters they might have with another male nurse.
Love it. Love it. Well, I'm curious. I know you mentioned in the beginning that you kind of started off in postpartum L&D, maternity, type nursing. So I want to know what got you even interested in L&D.
Okay. So I was one of those, I got my bachelor's degree in biology, got close to my senior year and was finishing, and I had no idea what I was going to do. I thought I was going to go to med school, didn't know if that was for me, and then thought about going to dental school, still didn't realize that was something I was passionate about at all. And so my brother was the one who kind of said, well, why don't you try nursing? Because his wife was a nurse, and he said, you will get exposure to the medical field. You'll see all different types of patients, and you can kind of go from there and see like what you like and what you don't like. And maybe the medical field is not for you. So I had received my bachelor's. And so I went to Rush University to do their general entry master's program, which is an accelerated master's program. There's like a few of them, I think, that are available. Super rigorous, very difficult. But I went into that thinking I was for sure going to end up in either ER or ICU, not L&D, not peds, maybe psych, so those were things that were on, my horizon was psych and ER, I think partway through it. And then I had my OB rotation, and I had one of those very straightforward multip, delivered really quick, no issues. She was a young mom, so pushed very little, one of those like awesome deliveries.
Quick and easy and amazing.
Yes.
Yeah.
A nurse's dream delivery, right?
Yes.
So
yeah, I had someone in my story ask story questions the other day, like, do you guys get overwhelmed or mad when someone comes in and they just deliver really quick? And I'm like, no, we love those. No, that's like the dream patient.
Right, exactly. Those precepts are our favorite. You're like, quick and done, we're good.
Yeah.
Of course, when the baby comes out, fine. But
yeah, right.
But yeah, I had one of those deliveries, and I just like sat there in awe, just like, I just saw a baby born, and I was like, this is for me. This is what I need to do.
Love it.
And so I, made sure I discussed that with my, my instructors in nursing school and letting them know that this is something I'm interested in. Is it possible for me to do this? Because I know I'm a guy. And, they said, we had a male nurse graduate from here several years ago, and he's over in California now, and he's doing great. And totally, this is something you can do. So one of the instructors there, she was our lab instructor, and she also used to do the birthing classes. So she kind of asked me to come on with her and help with the birthing classes. And so I did a couple of the birthing classes with her, and I got some feedback that was not great.
Uh-oh.
It wasn't like a lot of bad feedback because I was a nursing student, right? So like I was just trying,
of course.
She had us do presentations about, postpartum and, and then what to expect in the hospital. And there was one patient who said specifically, like, he is a boy. He can never understand what we're going through. So how could he be in this field? This is not for him. I would never want him as my nurse. And as a novice student, I said, okay, fine. I don't think I'm going to do this. Like, maybe I should decide something else. And she said, don't let this discourage you, because you're going to face this in any specialty you go to. Someone might just say, like, you're not cut out for this. And it has nothing to do with you. Sometimes it's just that one interaction that you had, right? And so I kept going. I said, okay, fine, I'm going to do this. I graduated. And as a new grad, finding a job, you would think as a new grad nurse would be simple, especially now during a pandemic when when you need, their nurses needed everywhere. But at that time, there wasn't a pandemic. This was back in 2013. So finding a job out of nursing school was really hard. So you sent applications everywhere. And I got an interview for a psych position. And, I had sent a few applications in for L&D also, but never heard anything back because they usually wanted an experienced nurse. But HR there looked at my portfolio and said, it looks like you have a strong interest for L&D. I have an interview available for, I have a position available for L&D. I can get you an interview there. I'm not going to guarantee that you're going to get it because they are looking for an experienced nurse. But I think having an MSN and then just my interview in general, she really liked me. I got a position and I worked there for about a year and transferred to another hospital afterwards. But it was my experiences in nursing school that really pushed me in that direction. Just seeing a delivery and seeing a beautiful delivery itself, was what got me hooked. So
that's amazing. Yeah, I had a similar experience in nursing school too. Had a delivery. I mean, I knew kind of before nursing school that I wanted to go into L&D just because I've always been interested in, just pregnancy and obstetrics and everything. But it was really kind of that solidified it. So that's cool that you had a similar experience. Well, I want to know if you have one, what is your favorite part about being an L&D nurse? Or maybe your favorite patient to take care of, like type of patient.
Favorite type of patient. Okay. I personally connect really, really strongly with IVF patients. I really do. And that's because my husband and I, we went through a surrogacy to have our son, who was our first child. And that was a really long, long journey to have him. And so I really can empathize with that struggle of going through an IVF journey. And I think that when it is successful, and even when it's not successful, I've had patients doing IVF who've come in with miscarriages and, but those are the patients that I truly, bond well with because I feel for them, and I know that how much work goes into that and how much anticipation and letdowns and, all of that. And so those are the patients that I think I enjoy the most and bond with the most for sure. But I also I worked at another hospital before working at St. Joe's, and the patient population there was much younger. And those are another, I really, not, that I'm like teen pregnancy is the way to go, but
yes, I love those patients too. You almost grasp onto them and you feel like you help them. So I had a patient a couple weeks ago was it last weekend? Yeah, that I had a patient. It was a similar situation where she was younger. Right. It was her first baby and she wanted to go, unmedicated. So I just kind of you just grasp onto them and you're like, let me take you on this journey. We can do this together. You
really want to take care of them. Yes. They're so vulnerable, but also I feel like this is another part of being a male nurse, I think, is I think when I do take care of them, it kind of gives them just a good example of I try to be a good example of a guy for them, this is an example of a guy who's going to take care of you, right? Like someone that you want someone who's going to be there for you. And because a lot of these teenagers, the dad's not involved, right? Or he doesn't show up, right? And so,
or maybe he is there, but he's not there.
Exactly. Right. Exactly. Yeah. So I think those are definitely the patients that I do well with the most.
Yeah. Love it. Love it. Well, let's kind of switch gears and talk about some boundaries. I know we kind of talked about it a little bit in the beginning, and you said that sometimes people have religious issues that they are, not cool with males being in the rooms. Have you ever had any sort of other boundary issues that you face with certain patients, or maybe you can elaborate more on the religious aspect?
Yeah. So it's typically patients with a Muslim faith, and they, in general, because they are, we call them modest patients, because they say that, label them as modesty. And, you can kind of spot them when they come in, because usually their hair is covered or they're entirely covered. And you do your best to be as respectful to them, because you know that is an important part of their religion. And I would say I know for a fact that this irritates a lot of nurses I work with, because a patient will come in and say, I'm the next admin, right? Like, you get the next patient, AJ, right? And
it's your turn.
Patient comes in and she's modest. And then they're like, okay, well, we got to switch things up. And sometimes it makes things difficult. And I really appreciate the nurses I work with for not giving me a hard time about it. Because they know, it's not my fault. I can't do anything about it. But I would take care of them if I could. But if they're saying no, then we have to respect that. And that's just the way it is. I feel bad for them having to switch up the assignment. And that's something I think people should know, is that when that does happen, when you do refuse a nurse, you should be aware of the fact that they have to switch their whole assignment. The whole floor needs to get switched up. So it does cause a little bit of issues. But yeah, so that's primarily the patient that we get that. And I've had cases before where we didn't have anyone else available. Right. So I had to take care of them. And so what I tell them is that, and this is usually so for example, in a postpartum setting, I will say, I will come in and help you, and I will not do any breast examination, or I will not do any vaginal examination. I'm going to have the resident come in and do that. But otherwise, I'm going to help you entirely as far as your pain medication goes, anything with the baby, taking care of, changing the diaper, and any education that you need, those sort of things I can help you with. But I won't do, any assessment on the areas that that you for sure don't want me to look at. And I've had situations before where people were really receptive to that, where they were like, okay, yeah, that's fine. I'm totally fine with that. As long as you are not assessing my breast, you're not assessing my vagina.
Seems reasonable. Yeah.
Right. But again, it's part of my job to do those things. So it's I have to make sure I have someone available to me who's going to do that, and who's going to be okay with doing that.
And who can do it properly the way that you need it to be done.
We're supposed to do it. Exactly. Yes. And I've had a case before where someone who was not modest, who said, I just don't want him looking at my vagina. I'm like, well, everyone's going to. It's going to happen.
Yeah. Right.
And this kind of takes me to the funny thing is, when a patient comes in and they're just full on active labor, at that point, I know a patient that maybe would have said preferred not a male nurse. They don't care at that point. They're
Never.
I don't care.
I don't care who's in here.
Get the baby out.
Yeah.
Right? Yeah. But yeah, I wouldn't say I come across a lot of boundary issues for sure. As a male nurse, no. And never anyone who's hitting on me or anything like that.
I was going to ask that too. Has there ever been that situation for you?
Okay, so I have a funny story. There is a funny story. So as you know, when we do epidurals, right? We are really up and close and personal with patients during that moment, right? Yes. We're holding their hands, sometimes hugging them. They're hugging us. And I had a patient, she just didn't know what to do with her arms. They were just, every time she had a contraction, they were everywhere. She was grabbing my arm, grabbing my wrist, grabbing my butt, couldn't figure it out. And at one point, I think she had her hands in her lap, and then she had a contraction. She kind of leaped forward and she full on grabbed my crotch.
Oh.
And I went and then, she moved her hand quickly. And then at the end, she goes, I'm so sorry, I grabbed your wiener.
No.
And I go, it's okay. She's and I kind of had to say, it's happened before, but it really
But it hasn't, yeah. I was going to say, that's probably what I would have said.
But that was the one time that something as I would say inappropriate happened, but it wasn't intentional, Yeah. She knew
that is so funny.
And
I can't. I was just going to say, I can't. Go ahead. I keep interrupting you.
Most patients, when they meet me, they know that I'm gay. have that persona. And I think they know, like, okay, he's gay. Like, I'm not going to go, I'm not going to hit on him or whatever.
Right.
But yeah, I think that also helps with part of the bonding too. And them getting over the fact that I am a male nurse, or like, all right, he's not interested in me in that way, so it's fine.
Right. I mean, I think that's worth something to say, to say that. And I
know that there are other male OB nurses out there that aren't gay.
Aren't gay, right? That's what I was going to say. There are definitely probably, them out there.
Yes.
So that's probably worth, and I mean, that might make them a little bit more comfortable that you are.
Yeah, right. And I think, it's one of those things that as being gay, you're like, okay, this is, in my favor. But,
yeah.
But there, I work with several male OBGYNs and none of them are gay, so it's one of those things where it's like, there's all these male OB-GYNs. So if you see a male physician, why not see a male nurse, right? Like,
isn't it odd? I know I was going to ask your opinion on that in the next question of like, there's so many I work at a hospital that we have residents, and it sounds like that you guys work with residents too. And there's so many male OBGYNs. So it's like, it's odd that there's this weird, like, there's not a lot of male L&D nurses. So I didn't know if you had any opinion on like why that exists.
I think it's just because, nursing has been like coined a feminine role.
Yes.
Right.
Yes.
It's because from as long ago, nurses developed from sisters, from nuns, and then kind of took that course. And it's within only the last century that there's been male nurses, right? So
true.
I just think that there's that association that if you're a male and you work in the medical field, you have to be a physician, right? There's no way that you're a nurse.
Yeah.
And then when you are a nurse, it's surprising to people. They're like, oh, have you even had some of the physicians say like, well, why didn't you just go to medical school?
Interesting.
Why didn't you go into business?
Yeah.
Because that's not the route that I went, that's not the field I chose. So I do sometimes, especially now, I think it's surprising when people ask that question, because it's like in the day and age we live now, it's like, there are so many male nurses now.
Yeah.
So why is this so surprising to you?
Totally. And which is good.
I see as a male L&D nurse, it can be surprising because, it's maternal newborn work, right? And I feel mostly that is because a lot of male nurses are afraid of going into that field.
Ah, good point.
I've had students, because I worked as a clinical instructor for a while, and I've had students that I knew that they were interested in it, but they didn't pursue it. And I think it's because they still felt like, I can't do this because, people are going to make comments and I'm going to feel uncomfortable, and even from straight males that say I just don't feel comfortable staring at another woman's vagina.
Yeah.
Yeah. And I think it's just something they have to get past and say okay, well, there's OBs that do this all day long. You're not just staring at someone's vagina. You're helping them have a baby.
Right.
You're helping them become a family, or adding to their lives. It's not, this is the example I say.
At all.
Right. Just because you're not an amputee doesn't mean that you can't take care of someone who is, right?
Exactly.
Someone who is having liver failure. You never had liver failure, but you're taking care of them, right?
Exactly.
Just because you don't have a vagina doesn't mean you can't take care of someone with a vagina, right?
Yeah. So, totally. That's a great point. All right, the sound of that heartbeat means it's time for this week's segment of Birth It Up Babies. This one says, I wanted to share some positive feedback about your epidural class. Number one, I first took my hospital's birth class that had 6 birth stories. Some ended up with epidurals or C-sections to show various birth types, but they all started saying they really wanted natural births, which I thought was very judgy of the course. I would agree with that. It also just said, and she quote, some things will be different with the epidural. And she said, without going into it. I love that your course was designed for those who want an epidural. Number 2, I actually pushed for 6 hours. Oh my goodness. But I didn't even realize that much time passed because of your tips to not look at the clock, to take one contraction and push at a time and focus on resting between them. When my doctor told me it had been 6 hours, I was totally shocked and then immediately felt exhausted. I bet you did. I hope that wasn't active pushing for 6 hours. Oh my goodness. Because sometimes if you labor down, they will calculate that within the pushing time. So I hope you got a little break, but wow, that's a long time. She ended by saying she was surprised I was doing so well because most moms would have ended up with the C-section long before. Again, I would agree. She said, "Thank you for the great course." Oh, I love it. This was such a good one. And if you want to have an even better birth, just like this mama, head on over to mommylabornurse.com/courses to get lifetime access to all 3 of my online birth classes.
Well, I do want to hear, AJ, can you share any memorable moments that you've had over your past 8 years? You've been an L&D nurse for 1 year longer than I have. I've been in for 7 years, but we graduated the same. I was 2013 too, graduated in 2013. Okay. I was in the ER. So you have 1 more year of experience than I do in L&D, which doesn't really mean anything. But do you have any memorable moments that maybe just a few ones that you can share from births that you've attended over the years?
Yes.
Crazy, heartwarming, anything.
So many, right?
I know.
Okay, let's start with one as a novice nurse. And I'm talking very, very novice nurse. I was in orientation at the first hospital I worked at. And I was probably within the first week, maybe the second week, running around the front trying to find IV stuff because someone said, okay, you're going to start the next IV, right? Because you're still learning to do IVs and trying to perfect that. So I'm, here looking for my IV stuff. And someone was walking in the front door and they are screaming, right? And I am like, okay, I'm not here. It's not me because I'm just in orientation. And this woman is walking down the hallway in sweatpants, right? I think she was trying to make it up here as fast as she can. And she stops and she's like, and she grunts, right? And I look at the secretary. She looks at me and she goes, "Nurse, go." It's like, I run up to her and she had the baby in her sweatpants. Oh. So I had to, what do I do? And at this point, there's so much going on at the time, but I remember getting her to the ground and kind of then pulling the sweatpants down and the baby's there. And at that point, the OB runs in, but and I'm thinking to myself, what did I do? Do I need to be doing this? Because one of those moments that are so exciting. And and
I'm sure was the baby completely fine? Because they usually are when they come out that fast.
Yeah. The baby was totally fine.
Cool.
And I remember we had to get her up into a wheelchair and she's holding the baby and cord is still attached. Yep. And but I remember thinking I don't know if I can do this because that was so intense. But then later going home being that was so awesome.
Yeah, totally.
When are you ever going to see that? Right.
No, never. Yeah. No other set, maybe in the ER, randomly, but yeah.
Right. And then another time at that same hospital, I had a patient that came in and she precepted, right? She didn't speak English very well. And, when someone's precepting, precepting is when you deliver really quickly. But when that happens, you're not calling a translator.
No, you just do the best you can. Right.
Right. Exactly. And it wasn't she didn't speak Spanish. I don't remember what language she spoke. She was from somewhere in China but it wasn't Mandarin, but she delivered one baby. Right. And we thought that was it. Right. And then she's staring at us and she's still, moaning and groaning and she points at her belly and then holds up 2 fingers. Oh. And we're like, oh dear, there's another one. So they didn't even ultrasound her. They took her right to the OR.
Yeah, of course. Because she knew, what that means.
Right. When she said, there's 2 in there. Yeah. So that was another one that was one of those super exciting moments. Another, I want to say heartwarming was actually the birth of my son. So
let's talk about it. Yes. We have plenty of time. So let's talk about it.
So my son, his name is Bowen. He is 3 years old now. And my husband and I had him through surrogacy. Mm-hmm. I don't know if you've ever had any episodes on.
I have a few. I've assisted with a few. And then I did have one where I was the primary nurse. So sweet. My gosh.
Such a beautiful thing.
Yes.
And for anyone who is a surrogate out there, that is, in my head, that is the most amazing thing you can ever do for someone.
Agreed. Agree.
You know, like I didn't say that's even more than like giving an organ, because you're giving someone like, you're helping someone like complete their lives, and like give them this baby. I don't know. It's just the most amazing thing to me. But we went on this journey with surrogacy, and it took a long, long time. It took 3 years for us to have our son. And we, you know, we had a few losses along the way. We had a loss at like 11 weeks. And then we also had a loss of twins. And that was really rough. Yeah, and so when my son was born, it was an emotional roller coaster. And I'm sure you could relate to this, but there is something called the nurse curse.
Oh no, what happened? Tell me.
So with L&D nurses, for some reason, not all of them, but you know, there just tends to be a thing that happens to the L&D nurses when they have their babies. It's just dramatic. And I don't know why, because you would think we'd go in there like, we know what's going on and we know what to expect, but just things, it's those anomalies that happen. So our surrogate, so amazing. She was induced an elevated blood pressure. She was 38 weeks. And she had a second elevated blood pressure. And then they said, let's go ahead and induce her. You know, this baby is measuring kind of big too. So they started her induction. Everything went so perfect. The whole induction went so great. She progressed so quickly. This was not her first child. But then when he started to come out, first of all, okay, so my husband is white and I'm Indian. And so the whole time thought that he was from my sperm, because what we did is we kind of mixed it up and took it a chance to see whose sperm was going to take. Yeah.
Okay. Yeah.
So we put one embryo of mine in and one embryo of my husband's in, and then said, you know, like whoever takes it, we could end up with twins, because that does happen. But we were seeing the head come out, and it was a blonde head. We did right then, like, all right, so this is, you know, my husband's DNA. Yeah. But then I remember thinking, my husband was an 11-pound baby, and his sister was an 11-pound baby, and I was like, oh no. So he starts to come out, and, you know, when the head comes out and then it turtles back, you know, it was doing that. So, and it was a long head. Like, I remember thinking like, God, it's such a long head. I'm in the room with my husband. We're holding her legs, and I'm trying really hard not to be the nurse, right? Yeah. And then I see that happen, and I turn around, and we have baby emergency buttons. I went ahead and pushed it myself. Yeah. And we have, and one of my really, really good friends, she's one of my like best friends at work, Jasenia is her name. She was our primary nurse, and she stayed late that night. She was only supposed to work till 7. She stayed until he was born, till like when he was born right before midnight. She stayed, and she kind of like gave me a look like, what are you doing? Like, you know, but I pushed the button because I just saw it, and I knew it was going to be a shoulder, and it was. So he was a shoulder dystocia, which is a very scary situation. And he was like a bad shoulder dystocia. You know, like there's like those that like legs go back. Yeah. We're fine. They do, you know, the Mick Roberts, and they get the shoulder out. They do the superior pressure. Yeah. And the shoulder pops out and it's fine. And that wasn't working. They were having to go to secondary and, you know, and like the other maneuvers and like the corkscrew. And I was like, oh no, you know, in my head, like I'm going to pass out.
Yeah.
I didn't see him born.
I would have been like this, like closing my eye, like, oh, if that was my baby. Oh.
So I grabbed my husband. I pushed the button because I knew the rest of the team was going to come in, like NICU and all that. Yeah. And I grabbed my husband and I said, let's go, like move out of the way. And our surrogate was delivering in one room, and we had the next room next to her reserved, and there was a closet in between. Okay. You could go in between the two rooms. Okay. You know, they had a shared like utility closet or a shared closet between. So I like pulled him into like that closet. Funny thing, because we're gay, right? I pull him back into the closet, right? And I said, we have to move out of the way. And then my son came out, and we didn't even see him born. But I heard he came out, and I remember them calling the time that he was born and not hearing a cry. And just like feeling my whole world fall apart, you know, just like everything. But it was like, you know, it was only like a few seconds, right? But you're wanting that cry right away. But it feels like
a freaking hour. Yeah,
exactly. And then I hear him cry, and I, as like your own child, I don't even know how to describe it, but like I lost sensation of my whole body. I fell to the ground. You know, my husband is holding me, and my husband had an Achilles, like, he had an Achilles surgery, so he was in like this little like
oh no
Captain Hook kind of thing. And He's trying to take care of me while I'm on the ground. So dramatic. But
oh God.
he ended up being okay. And he was fine. I mean, he came out like we call them stun babies. So when they come out and they're kind of stunned and like their arms aren't really moving and they're like not as reactive, but he's crying.
Yeah.
And I remember just like grabbing his arms, like, so he was brought to the warmer and I pushed my friend out of the way who's taking care of him. And I'm trying.
Let me get in. Yeah.
I'm trying to like stimulate him and I'm like, come on, baby, you're okay. You know, like grabbing his arms, trying to check his reflexes. She was like, my friend Jasenia was like, he's okay. You guys are fine. You know, like, let me put him on your chest. So I just skin to skin with him. And
yeah, I got to ask, how big was he? Was he huge?
9'11".
Okay. That's pretty big.
So not 11 pound baby. Yeah. 9'11". But he was big. Yeah. But then our poor surrogate, she had retained placenta afterwards. Oh, so they had to like rush her to the OR and they were going to have to do a hysterectomy, but they were able to save that. And as she was leaving the room, so I rushed over there to like see her and she was like, she was planning to have another one for us after. And she was like, I don't think I'm going to be able to care for you again. I'm so sorry. Like that's what her thoughts were. And I'm like, was to apologize to me. And I was like, you didn't do anything wrong. Like you did, you know, like, please don't apologize to me. Like I'm crying and like, but she went on to be a surrogate again. She didn't do it for us because we decided that wasn't what we were going to do. And we had another baby when we adopted our daughter because that kind of happened really quickly. But yeah, so that was an amazing story that I feel like as a labor and delivery nurse is one of those things that like I was able to appreciate through the eyes of an L&D nurse, but also as a parent at the same time. But not the patient, you know? So
yeah, I think it changes. I mean, it's different, obviously, when you're not going through it as the patient, but I think it naturally becoming a parent changes your practice. I mean, I feel like it's changed mine tremendously in such a beneficial way.
Like as a, doing postpartum teaching now, right? Like you have like the by the book that you're trying to teach them, but then you also have like, but in reality, this is what's going to happen.
You're like, don't use this, but actually this is like, I always say, you can still do the suction, just use a suction bowl, but I have this thing called a nose Frida and that thing works way better. I know it's kind of gross, but they have the automatic ones. I was like, don't even mess with the bulb. Like, I know we use the bulb here, but.
Or when we tell the patient, like, you're going to sleep when the baby sleeps.
Yeah.
And now I'm like, that's not a thing. I'm sorry. I'm going to tell you that, but that's not a thing. You're not going to sleep. I'm so sorry.
That is too funny. Well, AJ, if you don't mind wrapping up this episode, do you have any advice that you would give to a first-time mom that's about to give birth? We have a lot of second-time moms and third-time moms and whatever time moms, but a lot of first-time moms listen to this episode. So let's say you have any advice for them.
First time's mom. I have two things of advice, actually.
Okay.
When you go in for an induction and someone's telling you're being induced, anticipate 3 days. I'm sorry. I know
Good
that's
advice.
like,
yes.
They tell you like, it could be anywhere from 12 to 24 hours. No. Go in there with a mindset that it might take 3 days long so that when it does take 2 days, you're like, oh, it happened sooner,
Very good advice.
Because I've seen inductions go that long before and that's something you need to keep in mind that this is not going to be a quick thing. Another really important advice, I think, for anyone would be no labor is the same. Your labor is not going to be the same as your best friend's. It's not going to be the same as your sister's. So when you go in there with that mindset of your labor going to replicate theirs, you're going to get disappointed. You have to own that your labor story is your story. It's individual to you and no one's is the same. And so whether or not you get to deliver vaginally or whether you have a C-section, it's a success. The fact that you are given your healthy baby in your arms is a success. You did not fail because you had a C-section. There's no failure in that. You carried that baby and that itself is such an amazing thing that you are carrying that child and you brought a healthy baby into this world. You did your job.
Yes,
you did.
Absolutely.
Part of your job isn't to just deliver the baby. Sometimes it doesn't work that way.
Right.
And so when people say like, oh, I failed, I had a C-section, you did not fail. You did your best. Or maybe you didn't even get a chance to labor because it wasn't in the,
in the
it wasn't part of your story. Exactly.
Right.
So I think for people to go into there knowing that my story is going to be my story and it's not going to be like so-and-so's is so important to know.
Yeah. Love it. Love it. Well, that's great advice. Thank you so much for sharing that. If anybody wants to follow along, do you have an Instagram that you want to share so anybody can see your cute kiddos?
My handle is too Ajit to quit. So my real name is Ajit, but I go by AJ. So that's the number 2 and then AJIT and then the number 2 again. And then quit, QUIT. So too Ajit to quit, like the old.
Love it. No, I love it. I love it. Well, we'll put that in the show notes for people, a little link for people to click onto if they can't spell it out. So you can just click in the show notes.
Hopefully I will start putting up some other things because I am in school. I'm finishing my psychiatric nurse practitioner right now.
Oh, cool.
And I plan to do that in the future, kind of switch fields. But my plan is to work with postpartum depression. So
love it. Such a needed
stay tuned.
Yes. Love it. Love it. Well, thank you so much for joining me today. This was fabulous. I think we had such a fabulous conversation. So it was a pleasure. Right. Thank you for joining me.
Thank you.
Already feeling a little more confident about pregnancy, birth, and newborn life? Don't forget to hit that subscribe button so you can continue to erase the unknowns and never miss an episode. And if you're looking for even more, Instagram is definitely where I hang out the most. Come join our community of more than 500,000 moms for birth education, tips, and solidarity. You can find me at mommy.labornurse. Check out today's show notes and a searchable library of every Mommy Labor Nurse podcast episode at mommylabornurse.com/podcast. And while you're there, be sure to head to the blog to learn about our online birth classes too. See you next week, and remember, you can have an even better birth no matter how you deliver.